Hello everyone. Today our topic to discuss topography anatomy of the popliteal area. The popliteal fossa is a diamond-shaped area behind the knee genu. The upper side of the diamond are formed by the middle semitendinous and semimembranous muscles and the lateral bicep femoris muscle. And the lower point of the diamond is formed by the head of calf, means gastrocnemius muscle. Now we will discuss the boundary. The upper boundary of this area is a circular line drawing about the 6 cm above the kneecap. And the lower boundary is a line drawn along the bony prominence of the shin bone tibia. Now going to discuss the skin. The skin in this area, means in the popliteal area, is a thin and flexible branches of the posterior femoral cutaneous nerve and through the underlying fat and connective tissue, reaching down to the joint line. At the boundary with the front of the thigh, the saphenous nerve branches off toward the middle side and the middle of the popliteal fossa. The superficial popliteal lymph node are situated. The popliteal fascia is a continuation of the thick fascia lata and it is as dense and tough as an aponeurosis. Beneath the popliteal fascia, running almost through the middle from top to bottom, is the tibial nerve, which give off muscular branches as well as the medial cutaneous nerve of the calf. Together with the small saphenous nerve, the cutaneous nerve travel in the groove between the head of the gastrocnemius muscle and the continues as the sural nerve. Lateral to the tibial nerve is the common fibular or peroneal nerve, which closely follow the middle border of the bicep femoris tendon. The common fibular nerve give off the lateral cutaneous nerve of the calf in the popliteal fossa. We continue to the popliteal vein. The popliteal vein lies medial and deeper than the tibial nerve. And then we have popliteal artery. The popliteal artery is a deepest structure, is even deeper and more medial, closest to the femur. In the popliteal fossa, the popliteal artery gives off muscular branches and the 5 genicular arteries. The superior genicular artery, lateral and medial one, originate about the joint line with the larger lateral one wrapping around the upper border of the lateral femoral condyle, and the middle genicular artery branches off the popliteal artery lower down, ramifying in the posterior capsule of the knee joint and the cruciate ligament. The inferior genicular artery originate at the joint line 3 to 4 cm below the superior one. All these arteries except the middle one from deep and superficial arterial networks in the anterior region of the knee joint. Going to discuss the bottom of the popliteal fossa consists of the popliteal surface of the femur and the posterior part of the capsule of knee joint, reinforced by an oblique popliteal ligament. Here is also the popliteal muscle, musculus popliteus, which began on the lateral condyle of the thigh and attached to the posterior medial surface of the tibia. To discuss the cellular space of the popliteal fossa, along the sciatic nerve communicates with the posterior bed of the thigh along the course of the femoral vessel, and the fiber is connected through the adductor canal to the anterior region of the thigh up to the fiber of the femoral triangle. Along the course of the popliteal vessel and nerve tibialis, the fiber is connected to the deep space of the posterior region of the shin. Pus from the popliteal fossa can separate in such a ways. Thank you for your attention. It was the topographic anatomy of the popliteal area.